Welcome, welcome, welcome back, my Be Health Empowered family, to another episode of Excuse Me, Doctor. My name is Dr. Melissa Clark. I am delighted to be here with you. And for those of you who are here all the time, you know to call me Dr. Mel. So for those of you joining for the first time, welcome. Please call me Dr. Mel. And please remember that we are here each and every week for the same reason, which is to make sure that you have all the information that you need when it comes to your health and your health care to make wise health decisions, not just for yourself, but for your family, your loved ones, and your community. So we're delighted that you're here. And if you wouldn't mind, as we go through the show, if you haven't done it yet, please hit that like button if you're checking us out on Facebook and the subscribe button if you're checking us out on YouTube. And we create an amazing week here by making sure that you have all the information that you need, right? But in order to do that, I need to have my incredible co-host with me on the screen to make it an unforgettable experience. And I'm welcoming them right now.
You
Hey, Lila,
rang.
Rain, how y'all doing?
You
Hi,
rang.
everybody.
What's up, y'all? What's up, live?
Hey,
How are
what
you?
up? Good.
What it do?
Happy
How y'all
Monday.
doing? Happy
Happy Monday.
Monday. Happy Monday. Y'all ready for today's show?
Yeah, always. But I'll admit, this topic hits close to home today. We're talking about
Indeed.
Alzheimer's today. So,
Yeah.
you know, I've had folks in my life deal with it. Uh, we've all been touched by it in a number of ways.
Yeah.
And so we want to know from the audience, just what's your experience with Alzheimer's and dealing and living with people, your friends or family, loved ones that may have Alzheimer's.
Yeah.
It's a hard topic, but we have to talk about it.
Yeah.
Yeah, that's exactly right, Wayne. And one of the reasons we're talking about it today is because it is Brain Awareness Month, right?
It
Brain
is.
Health Awareness Month. And so Alzheimer's doesn't just affect the person who's diagnosed. We know that it goes through and affects the entire family. And part of what we're doing today is removing the fear around talking about Alzheimer's and trying to replace it with knowledge about the disease and empowerment, of course, because y'all are the Be Health Empowered family, and understanding how to form the right community to support our loved ones who have that diagnosis.
Yeah. I like that because let's be real. When someone starts forgetting things, especially as we get older, it can be scary. But not every memory slip means Alzheimer's, right?
Exactly, Lila. We're going to break all of that down. What is normal aging versus what's not? What are the warning signs that we need to look for? How the science is evolving? Because we talked about this a couple years ago, and there's new information on the horizon that we need to be aware of. So we're going to do an update too. And we're going to hit prevention because there are things that we can do. So that's all important. We're going to cover it all.
And of course, we're going to talk about love because caring for somebody with Alzheimer's is one of the most profound acts of love that you can do. That can be done, and it takes a toll on everybody, entire family, the entire support team, and all. We're going to talk about that and everything the caregivers need as well.
Yeah, so true, so true. So everybody get comfortable, grab your notebook, tell your family and friends to tune in right now because this episode is not just about the science, it's about real life.
Right. And we have an expert who's going to be joining us with the answers that can help you take action, make an action plan for yourself or for your loved one, whether you're concerned about your own memory or supporting someone in your life.
Stick with us. This is going to be one of those conversations that might just change your life or change a loved one's life,
Yep.
So, but before we go there, we have the week that was.
Well, and
know,
before we go to the week that was, everybody share, subscribe, like all the
yeah,
things. Right?
Right.
all of
Okay.
it, all of it, all of it. Cough,
And put your
grab a
questions in the
tissue,
chat.
And put your questions in the chat.
and if you're dealing with someone with Alzheimer's, a loved one with Alzheimer's, please put it into the chat. We want to hear from you, right?
Yeah, your experiences and what you've learned along the way. Yep.
All right, let's go to it.
All right, the weekly recap. So, why don't we start off with number 2? I know we go a little bit out of order, but let's hit that COVID variant piece off the bat.
Well, we've heard about the razor blade throat and everything. So we heard this new COVID variant could it bring a summer surge?
Right. Well, yes, it could. And we need to be prepared for it. It's called NB1.1.8.1, right? That's the name of the variant, right? It's spreading rapidly throughout Asia and it's now in the US and it's seeming to outcompete the other strain. So it has some advantage that's making it more easy to spread. And what we're seeing is because the winter surge was a little bit smaller, so people didn't get COVID as much this past winter, and fewer people have been getting boosters. So all that taken together means that there are more people out there who are vulnerable, and we might have a really big summer surge.
Wow. Yep.
Wow.
Well, it's surging in Los Angeles. I can tell you
Is
that.
it?
Right.
It is. It is.
And
Wow.
Go ahead, Dr. Mill.
So this is the same variant that's causing the razor blade throats, right?
exactly, yes. The good news, though, is that it's no more likely to cause hospitalizations than the previous strains, although, of course, that razor blade throat is going to be very uncomfortable. What everyone should do is stay informed, watch for symptoms, test, isolate, and consider getting boosted if you haven't recently, especially if you're in a high risk group, meaning you have underlying chronic diseases and ailments, or if you're 65 and older. And when I say stay informed, just like Lila mentioned, it's surging in LA. Remember, you can go to the BioBot data site, which tells you about wastewater in your community so that you can see, are there spikes of COVID? Because we know that the CDC is not tracking it anymore. So you can't necessarily go there to understand what's happening in your community, but you can go to the BioBot data website and find that out.
And a recent, vaccination, we can still get those if you're in a high risk category. Gives you strong protection, right?
Yes, exactly. And of course, remember to continue to just use your common sense precautions like hand washing. And if you're sick, please stay at home. So all those things.
Stay your behind at the crib, your own crib.
And put a mask on. It's okay. I
It's
don't care
okay.
how people look at you. People make comments. I get comments and stares all the time, but I'm going to put a mask. I do. I do.
In
Right?
LA?
Yes.
Yeah.
Wow.
Yeah.
Yep.
It's now not the norm, but it's still
Right.
common sense.
It's still
Yeah.
common sense. Exactly, Dr. Mill. It's not the norm, but it is common sense. Use your common sense.
Use your
All right.
common sense that your mama gave you.
Can I share a brief story, Dr. Mill?
Please.
I had a cousin, an elderly cousin, that was going to do a cross country train ride.
Uh-huh.
And he came in to where I live in Washington, D.C. area without a mask.
Ooh.
And I had to go buy him a mask because I couldn't imagine him being on a train for 2
for
to
3
3
days.
days.
Yeah.
Right.
No
This time
mask.
of year. At this time of year.
And he was in his 90s.
Right.
Yeah.
He's great, but he
Yeah.
was in his 90s. So
Yeah,
I
well,
bought him
I'm
a
glad
few masks.
you were proactive and did that. You
Yeah.
definitely helped him
So,
protect himself.
Yeah, I don't, I don't want to
So
talk
let's
about
go to the opposite end of the age spectrum and bounce back up to number 1.
Exactly. So COVID and pregnancy and what it can mean for your baby's brain. So Dr. Mel, we know pregnancy is a risk factor for having severe COVID, but is this suggesting that it could harm the baby as well?
Yeah, so researchers right there looked at populations in Los Angeles as well as in Rio, Brazil, and they compared 172 children born to moms who had had COVID during their pregnancy, and they
Oh,
compared them with 128 similar age children born before the pandemic. So people who would not have been exposed to COVID in pregnancy. And this was looking at little ones between the age of 5 months and 38 months. And the findings were concerning. Almost 12% of the children whose moms had had COVID when they were pregnant showed that they had some developmental delays compared to just less than 2% in the pre-pandemic group. So 12% versus less than 2%. So that was roughly a sevenfold increase in kids with developmental delays if your mom had COVID while you were pregnant. Well,
wow.
Wow.
Did it make a difference if the COVID infection was serious?
yeah, if it was a severe infection, it magnified the effect. So children were more likely to have developmental delays the sicker their mom had been during pregnancy
Wow.
with COVID.
So babies born to mothers with COVID-19 need special attention then, right?
Yeah, pediatrician experts in this area suggest really tracking them closely and advocating for early developmental screening and support, especially if the mom's infection with COVID was severe during their pregnancy. So it's just a way to heighten awareness. If you know somebody who had COVID when they were pregnant, encourage them to get their child checked, do the pediatrician checks for, the normal developmental progression for
Okay.
their child.
Wow. That's
Wow.
good information for us to be sharing. All right, screen time in your child's brain. So we know kids are using their devices more than ever now, and I worry that it might be affecting them. Is this something to be concerned about, Dr. Mel?
Yeah, so now we're moving to we're still talking about children, but we're talking about older children like 9 to 10 years old. So this
Okay.
study found that those children in that age group with more screen time can have some really serious concerns. They looked at about 1,000 children in the United States alone, but across about 21 states. And they used advanced brain imaging and tracking their sleep habits, and then how much time they were spending on their screens, whether it was a smartphone or a tablet or video game. And they looked to see how it affected their brain and their emotional health. And they
Mm,
found that the more screen time they had, the less sleep they got.
mm.
And the brain scans actually showed that in the brain, certain communication pathways for information were not functioning as well as they should. And they also saw that those people that had those brain changes had some mild symptoms of depression by their early teen years.
Wow.
So basically, bottom line, this showed sort of increased sleep time, decreased sleep quality,
Mm.
changes in the brain, increased risk for depression by the time you're a preteen.
Wow. That's heavy. That's the important wake up call for families. It sounds like we should be limiting screen time, and we've talked about that before, but we should also be setting up more creative activities for kids off of these devices.
Yes, definitely give options, right? And other
Yeah.
activities. And I would also talk about prioritizing good sleep habits for preteens, which include no screen time an hour before bedtime,
Mm.
getting 9 to 11 hours of sleep each night in that age group specifically to support healthy brain development and healthy emotional development. All that's important.
So we need to update the sleep hygiene stuff. Like, you have a
Yeah.
sleep hygiene routine. You stop watching TV at a certain time, you turn off lights, you do those things. Manage your screen time at least an hour before you go to bed. Yeah, it's all about sleep hygiene.
Exactly. Yep.
Yeah.
You
Okay.
got it. So what we got next?
You know what time it is.
The weekly debunk. Stopping misinformation in its tracks.
Betty Bama said, I saw on IG that a doctor said folic acid is unsafe and we shouldn't take it because it's synthetic.
I don't know about that, Betty. Excuse me, Dr. MEL, is that true?
No, it is not. There are a number, I shouldn't say a number, a handful of influencers. One of them is a doctor on social media who's big in alternative medicine circles who are urging women to not use folic acid supplements. And this is dangerous. So just so you know, folic acid is just the manufactured form of folate, or one of the vitamins, B vitamins, specifically B9, and is naturally found in dark leafy green vegetables, beans, and fruit. So great to have those in your diet for sure. But it's also included in a bunch of multivitamins that we've taken for years, right? Including Flintstones, right? that kids take. And so it not taking it contradicts global, not just the United States, global medical guidance that folic acid is safe and effective and crucial to our health when taken in recommended doses. For pregnant women especially, so I hope Betty Bama is not pregnant. For pregnant women especially, it's crucial because taking it decreases a common birth defect of the spine and brain called neural tube defects by 93%. So telling women to not take it is very dangerous, especially if they're pregnant, because of the risk of deformities of the spine and brain.
All right, so Betty Bama, go take a pregnancy test and find out if you're
Hopefully
pregnant,
not
and then
another Bama pregnant.
and then get some folic acid.
And this in no way reflects on people from Alabama.
No way.
No, in no way.
You have
The Excuse Me Doctor show does not endorse no love against specific states.
That's not what we mean by Bama.
That's not what we mean. You got to come to DC to know what a Bama is.
You got to come to DC.
There you go. There you go. Well, thank you all. We're going to see you back in a little bit because we're going to get into our show and introduce our expert. You know, many of us have had experience with Alzheimer's disease because of a spouse, a sibling, a parent, a close friend. There are about 7 million people aged 65 or older that are living with Alzheimer's disease, and that's projected to jump to almost 14 million, so double by the year 2060. I personally have had experience because of my mom who has advanced Alzheimer's, and it's still hard for me to talk about it at times. But I really encourage you at home to not tune this out because it might feel scary. Actually, please do the opposite. Lean in. This is about your power to love better, live longer, and not feel alone when it comes to this diagnosis. And for those of you out there like me who've experienced caregiving for a loved one with Alzheimer's, as we go through the show, I really hope that you'll put in the chat, what's the one thing that you know now that you wish you had known earlier about memory loss? And I think you, by doing that, can help other people who are also listening to the show. So we have an extreme good fortune to have with us today a powerhouse in Alzheimer's research who has a focus on strategies for preventing Alzheimer's in women as well as in individuals of color. And her name is Dr. Neelum Aggarwal. She's a board-certified cognitive neurologist, clinical researcher, and professor in the Department of Neurological Sciences at Rush University in Chicago. She is the senior examining neurologist for their Alzheimer's Disease Center Clinical Core, and she leads multiple NIH-funded consortium-led clinical trials in cognition and prevention of Alzheimer's disease. Welcome, Dr. Aggarwal. Thank you so much for coming back because you are a friend of the show and you always bring wonderful information. So thanks for being here.
Oh, it's good. So good to see you all and to just, hear the intro to your show of what's happening and what people are talking about. So it's great to be here.
Well, good. Well, let's start with the basics because a lot of people are confused between, dementia, Alzheimer's, what do those terms mean? And can you break it down in a simple way so that our audience can understand?
Well, dementia is more of thinking about your changes in your thinking over time. Okay. So what it means is that you have your memory, your calculation, attention, all of those things that we take for granted. Over time, if it changes, then we start to wonder what could be happening. And typically it changes in people over 65 slowly. But if it accelerates and starts to have a problem with doing your activities of daily living, that's when we get worried and wondering, is this a process of the brain is undergoing neurodegeneration? Okay. Now,
Okay.
Alzheimer's is one type of dementia, and that's the big thing. You have dementia, and then you have Alzheimer's. And it's just one type. There are many other types of dementia. So when people say she has dementia, I say, hey, okay, I got it. What type? And that's what we need to talk about Alzheimer's, because frankly, it's still the most common type.
Right. So tell us a little bit more about what's different about Alzheimer's dementia. What exactly is it? And how does it differ from normal memory loss that you mentioned that can happen over age 65?
Okay. So let's talk about normal changes in thinking over 65.
Mhm.
People who have changes in thinking typically say it's taking longer. Correct, but it's taking more time. Okay. Other folks may say, I forget, but then when I start to piece it together, I remember exactly why I came in the room. So again, there's some changes that are happening there. With Alzheimer's, it doesn't come back. It just does. The thinking and the details and the conversations don't come back. And I think that's the biggest thing to think about now with that, when people are wondering, is this normal or is this something else going on? Okay. And the something else going on is, you just talked to me, like, Dr. Mel, I can't remember anything that you've said.
Right. So a difference between the quote unquote senior moments, right, that people talk about versus actual changes in the brain that are going faster, leading to problems where that memory is just not coming back. You're not able to reconstruct things. Yeah.
Right.
So what are some of the early warning signs of Alzheimer's that people should be looking out for? Whether it's in themselves or in their loved one who they're with every day?
So I'm going to ask everyone to think about just daily activities first. Okay. Difficulty carrying out daily activities. Forgetting how to, let's say for a woman who's cooked her whole life, forgetting how to make a recipe that she's made 100 times, more than that. Activities that normally were done with ease are now more difficult. Shopping is becoming a problem. Okay. Where did I leave my purse, my keys? Finding it in different places is a problem. Okay. Managing money, if you were decent at managing money and now there's mistakes and bills, that's a problem. And I want everyone to think about, she used to do it, or he used to do this, and he's not doing it right now. That's a problem. Okay. And I think if we think about it in terms of that activities, then people are like, okay, I get it. It's not the way it used to be. Now let's think about maybe seeing someone about it, to talk about it, versus Dr. MEL saying, how's your memory? Because everybody's memory is fine. They all will say the same thing. Well, my memory is better than the neighbors. I mean, come on. And this is what happens. This is what happens. So I would encourage everyone, activities of daily living is huge. Finances is huge. And that's when the memory we start to see these other changes happening.
Yeah. I would also add, so again, distinguishing from the senior moments, which are just forgetting facts, the emphasis is more on executing things that you normally used to do or finding things. And I would also add to that driving, if they're more fender benders, or if the person is, your loved one is more concerned about like learning new ways to get different places, right? And just seem to recall how to get places, and are nervous about driving for that reason. I think all those things also add into that bigger picture.
And you know, Mel, one other thing, you know, I want to bring this up because it's a hard discussion to have with people, okay, about anything cognition and memory. It's a really tough conversation. Older people, I mean, you and I included, nobody wants to take our independence away from us. Nobody wants to do that. We want to be as independent, all of us. I have yet to meet somebody who says, I want to be dependent on someone.
Yeah.
Okay. So these questions are an entree into, hey, we've noticed changes in your ability maybe to do this. Let's think about it. Let's talk about it. Let's see what could be the reason. And people are much more receptive to, oh yeah, you want to keep me independent, right? Yes.
Right.
Yes.
Right.
Yes.
So emphasizing preserving independence as much as possible, as long as possible. Yeah.
Exactly right. Exactly right.
So you now mention, you know, things are happening and you want to preserve independence, and you say to your loved one, hey, let's go get checked out. When the person comes to their primary care or to their neurologist, what can they expect?
Well, first thing is when you come to the doctor and bring this up, you better be armed with stuff. This has changed. I used to be able to do this. It's not happening. Because these are the questions that let the primary care focus on what should be done. Okay. So a lot of primary care are great. They know what to ask, but I'm always an advocate for the patient and the family.
Yeah.
This has been going on for 6 months. This has been going on for 8 months. Now let's take a look and see, you know, how things have changed. So map it out, what's been happening, how much difficulty it's been causing. And then the doctors typically will say, okay, we now have to do a few things. Blood work to make sure you're not anemic, that there's nothing wrong in the blood, that you don't have an infection that could be causing these issues. We just talked about folate. Well, vitamin B12 is really important for older people. They're very low on vitamin B12, and it has a lot to do with eating and not eating full meals. Okay. But
vegetarians, I have to say, vegetarians, you get that vitamin from meat. And so if you don't eat meat, you're not going to get it. So very important.
Exactly. And really important. So focus on the blood. Then the next thing we do is typically we'll want to get either a CT scan of the head or an MRI. Okay. One or the other. We need a brain scan to make sure there's no stroke, to make sure there's no tumor, or something that can explain why these changes in thinking are happening. Depending on if someone says, oh, she looked weird and then started to talk funny, and now I don't know what this is, we might order an EEG. I mean, I've ordered an EEG to rule out seizures, okay? Because people can be confused having seizures that don't make them fall to the ground, but they can have seizures. So we do that imaging kind of workup, okay? And then the last thing, Dr. Mel, if we can, we try to do memory testing. And in the office, we can do a memory screen. The MOCA is a Montreal Cognitive Assessment. A lot of primary care will do. Takes 15 minutes and tells us we should be worried about, or just to assess, is their memory. Or you can go to the neuropsychologist and have them do testing. Good news is neuropsych testing is getting shorter now. It's not as long. It's not like this 3-hour deal.
2 or 3 hours, right? Yeah.
No, it's getting shorter. Yeah. But the reason for the neuropsych is to really see, are we having trouble in different parts of the brain for different functions? Or is it one area that is only the issue? It helps us figure out what kind of memory problem we're dealing with. So that's the workup right now. Okay.
Now, what are biomarkers and what role do they play in diagnosis?
Oh boy, I tell you, you just hit a major topic that we are really excited about, but we're also cautious. Okay, and that's the message for everyone listening today. We're excited because a biomarker is a marker. It's telling us, oh, you may be at an increased risk of developing this disease. So think about the prostate antigen, right? PSA, that's a biomarker, right? Think about breast cancer markers. Those are biomarkers. Well, we're trying to figure out which is the best biomarkers that we can get to predict whether someone would either have memory issues down the road or are already having issues that we think are part of the dementia and Alzheimer's. Now, the blood biomarkers is what you're hearing about in the news because they're easy, frankly, to get. You give a tube or a few tubes of blood, you get it run, and then you get a level of certain proteins that could say, yes, this is what we typically see in someone who has dementia and Alzheimer's specifically. And what that does is it helps the doctors focus on treatment and perhaps even following people into studies and whatever. Here's the cautionary piece of information I want your listeners to understand. We don't know fully if the biomarkers that we are looking at in the blood behave the same way as for different ethnic groups and different racial groups. This is huge.
Yeah.
Because if I'm basing my diagnosis on a biomarker that has been looked at in predominantly white populations, and I'm now seeing my people, Black and brown people, and saying, oh, this level means that I'm worried.
Yeah.
It may not be accurate. It may not even be a factor. So we have to be careful. And the good news is we are now looking at these markers in Black and brown populations to see if they make sense. Okay.
Right.
The other thing, Dr. Mel, this is also important, is that I want you to think about your patients and how many comorbid medical conditions your people have.
So ailments, chronic conditions. Yeah.
Okay. How many on average do your people have? Just these ailments people may have. Just give me an idea. 2, 3.
By the time somebody's in their mid-60s, probably 2 or 3. Yep.
Okay. We don't know how these biomarkers, how they function in people who have a lot of ailments, specifically kidney disease. Right? Yep. We know that when you have kidney disease, these markers are not as accurate. So that makes me think, okay, what about cancer? You had cancer, you had chemotherapy done, you're now in remission. well, how are these markers behaving? Okay, with that. We are learning more and more, and we're really trying to get a public education campaign out to the public that if these are the conditions you have, we still need to understand, are you even appropriate to get these markers drawn on you?
Right.
Because of the impact that these markers could have on diagnosing you. So this is a big deal, Dr. Mel. How are we handling these markers in special populations with, with a lot of disease, frankly?
Mm-hmm. Right. And I think this is important. I'm glad that we're talking about it because, some people, first of all, biomarker, just at its very simple, it's just a test. It's just a way that we can know in a very simple, straightforward way by doing a blood test, do you have a high risk for Alzheimer's disease? And it's important because ultimately we are going to have treatments that work for Alzheimer's disease. So the earlier that it can be identified, the better. And I think what you're saying is we need to make sure that across Black populations, brown populations, people with kidney disease, heart disease, whatever it might be, that what we're finding in a certain population that is a predictive test is true for everybody. And so it's so important for people to get involved in research and be represented, right?
Exactly.
And because too, isn't there like a discrepancy between how often Black, Latino, and underserved populations are getting Alzheimer's versus white populations?
Right, and there is, and that has been, so that's not a myth. That's what we're seeing consistently. Black and brown populations are getting Alzheimer's at a higher rate compared to the white populations. Okay, we're seeing that twice as higher rate for Blacks, 1.5 times for Hispanic. And, when you see those numbers and when you see this, the first thing people may say is, well, apart from race, ethnicity, what else could it be? And this is where I'm getting back to these chronic medical conditions. In the Black and brown community, we've got diabetes, we've got heart disease,
high blood pressure.
Absolutely. All of these things we now are realizing are contributing to bringing, and we think, Alzheimer's on sooner. And when it comes on, so more people are affected. Okay. Yeah. So this is how we're looking at it.
So is that why Alzheimer's has been called diabetes type 3? Can you break that down for why we might be hearing that?
That term was really hot a couple years ago. And it's kind of fallen off a little bit, but it's still pertinent. So if you're a diabetic, we know that there are changes that are happening in your brain that are not good from being a diabetic. And it's more than the small little strokes that we used to know. If you're diabetic, you think back to your patients too, right? He was diabetic. He had some small strokes, lacunar infarcts, white matter disease changes, all these fancy words say. But what we're finding with diabetics, their brains are getting smaller, okay? And when you lose brain volume, it's not good. It's just not good. Now, you and I, your fabulous team, we're all losing brain volume. We all are. It happens already in the late 20s and it continues. But when you're a diabetic, it accelerates. It's even more.
Yeah.
Okay. And so what happens here is you're losing brain volume, which means your brain's not functioning as well as it could. Okay. We also are seeing insulin that the brain is now not clearing. It uses glucose, but now the receptors for insulin, which are in the brain, are not picking up and taking in that as well as it should. And so before
It's
you
not
know
getting
it,
the energy. It's not getting the energy that the glucose should
Exactly.
be providing to the brain for the brain to do what it does. Yeah.
So there's this thing, what we say is dysregulation, fancy word for inflammation, right? And you hear about this all the time, inflammation. And that just sets up this massive kind of like flow of things happening that makes people really start to have a lot of memory trouble and having it sooner in age, you know, so at maybe 63, they start having trouble versus 73.
So given sort of this association with diabetes and chronic diseases, what are there any things that we can be doing to prevent Alzheimer's based upon the risk factors that we know?
Well, you know, it sounds bad, right? It sounds like, oh my goodness, all these things are setting people up. But I want you to flip the script a little bit. Everyone listening, listen, think about it this way. The doctors have just told you that if you focus on all those things, you could potentially make it better. So if you focus on your sugar and make sure, if you're not diabetic, stay that way. You know, be mindful of what you eat, exercise, do all the things you can so you do not become diabetic. If you have heart disease, take your meds, but also follow your cholesterol. Be mindful of your blood pressure. Know your numbers. Make sure that your numbers are, that you know what they are. And, you know, the numbers we like is 120/80. And whenever I say that to an older adult, they're like, are you kidding? I haven't had a 120/80 for years. And my answer to that is, how low can we go on your blood pressure before you start to feel faint or passing out? Okay. And that's now what the cardiologists and the other docs are looking to see. Just keep the pressure low. Okay.
Yeah.
And then the other piece is, when, you know, anything reversible, let's get on it. Let's start talking lifestyle, because guess what? You know, Dr. Mel, if you just look at lifestyle changes, we could cut the rates of dementia almost by half. There was an article in the Lancet. I don't know if you read that. And, you know, I'm a neurologist, and, you know, I deal with tough stuff. I deal with tough illnesses and et cetera. But when I read that article, when it came out way back, that if you took anything reversible, like that you can control, and really controlled it with the help of your doctor and your family, your dementia rates can go down by like over 40% when you're 50.
Yeah.
Wow.
That's huge.
That's huge. That is huge.
I want to try to get in one more question before we go to the audience, and that's, are we any closer to a cure or even an effective treatment?
Yeah, I think we are. I'm going to say that. I think we are. You know, neurology, especially with Alzheimer's, we didn't have an FDA approved drug for the longest time. You think of medicine, there are new drugs coming out all the time. And then you talk to me, we had nothing until the last few years. So we have one set of drugs that's geared to taking the amyloid out of your brain that we think is part of the problem. And you notice how I say part of the problem. And those drugs are FDA approved, and they are given to people who qualify to get them, meaning they don't have a lot of medical issues. They don't have bad heart disease. These people, because it can cause bleeding in the brain as a side effect of these drugs. Okay.
Yeah, that's huge.
It's huge, and it's there, and it happens. Okay. Microhemorrhages are occurring in some people. Then there are other drug development that's looking at the other protein for Alzheimer's, tau. So the drugs we have now are amyloid taking out, but tau now is looking at drugs that we can to remove tau.
Right.
And then we're looking at how do we have treatments for all those brain cells and all those little connections. How do we keep them healthy?
Mm-hmm.
So we're looking at medicines that, and then we have lifestyle, what I talked about earlier. So
Yeah.
and you know what? It's going to be a cocktail approach. That's the other thing I think the listeners have to understand. It's not one drug. It won't be. It'll be a cocktail approach of how do we put certain medicines on at certain times to keep the brain healthy.
Right. And just so people know, tau and amyloid are different kinds of protein that we see that are building up in the brains of people with Alzheimer's as their brain shrinks. These proteins are in the brain, and so these are the targets of some of the treatments that Dr. Aggarwal was just talking about. Well, thank you. I know there has to be a lot going on in the chat. We got to bring back Wayne and Lila to give us some insights as to what's going on, and see if there are any burning questions or comments to my question of what are some of the things that you've learned that you wish that you had known earlier. So what are you seeing out there, Lila and Wayne?
There's a bunch of stuff in the chats. I want to say before I get to some of the comments and questions is this is fascinating, right? And we've said at the top of the show, everyone on this show, Dr. MEL, myself, and Wayne, we have all been touched by this disease. So it's really, for me, I'm taking in all this information because I think a lot about, am I going to suffer the same way some of my family members have, right? So being able to get information about how to slow it down or maybe reduce the chances of getting dementia or Alzheimer's is really great. Yvonne Smith asks if memory exercises like Sudoku and puzzles, are they helpful? Those kind of brain exercises. Yes.
Yeah, great question, Yvonne. Yes, they are. And I'll tell you why we think they're helpful. When you do Sudoku and you do these puzzles, you are engaging different parts of your brain to figure out the problem. Okay? And if it takes you a while to do it, don't get frustrated. It's okay. If it's not coming right away, it's okay. You are building your brain strength, if you will, with those neurons. Okay. So always try to engage in something new. Okay. It's not just the puzzles. You could do new dancing. You know, dancing is a fabulous activity. Something new is where you want to be. Yeah.
I learn a new line dance every other week. So
no, it's so good. So good.
Okay.
Or a new instrument or a new language or
anything, right?
Something new.
Learning. Yeah.
Keep learning. Keep learning.
Yeah. There you go. There's that.
I did that because I follow a young lady online who challenges you to do things with your hands.
Yeah.
To separate the brain. It's amazing. I wanted to ask you personally because I had heard, I watched these things online because everybody is concerned about this stuff. They can say they're not, but everybody's concerned about this because it's affected so many people. Are the GLP-1s looking to help this process?
Great question. Great question, Wayne. Thank you. So we are getting information that people who are on these meds may be actually thinking better than when they weren't on the meds. Okay. And again, we have to start doing studies now to understand this. Okay. And, you know, people are going to say, well, shoot, why do you have to keep doing studies? And my answer to this is because you want to do something structured. A study gives structure, and it helps with giving as best information as we can. But you're right, Wayne. We're going to try to take a look at studies where people who are on these meds are going to be followed get memory testing, and finding out over time, how is their memory over time? And people, let's say with Alzheimer's already, if they're on these meds, is it slowing down the disease, right? That would be really impactful to know.
Yeah.
So we're on it. I'll tell you that much. We're on it.
Great.
Okay.
That's so interesting. So people who already have Alzheimer's, you're considering. Wow. Okay.
Yeah.
What are some practical things we can do, doctor, that families can do to create a safer and more supportive environment for the folks they're caring for with Alzheimer's and dementia?
So one of the things with families, I think I said this before, Dr. Mel, you got to get your team together first. Okay. And you got to be long on the bench. You got to have a deep bench, but you got to get your team. And, many times that team doesn't have blood family relatives on it. And I'm sorry to say that, but it's true.
Yeah.
And that is something that really has to be thought about with the family structure, whatever structure you have, who's in and who's not.
Wow.
Okay. And it's really important to understand that in the beginning before you start thinking about mom or dad or spouse. And once you understand who can do what, who won't, then I would say the supportiveness is going to be easier, because you're dealing then with people who are able to assist with the understanding, getting educated about caregiving. So here's the thing. We all think we can care for our parent or our loved one. Well, I just provide care. And I'm going to say, yes, but you need training. And how do you get training? I talked to a friend of mine, another physician, just recently. She was right on it. AARP, caregiving webinars.
Yep.
You need to get yourself, we all do this, get yourself prepared first before you start going out and supporting somebody. Even if you've done it a ton of times, I'm the caregiver in the family. I'm the one. Again, no disrespect, but please, you need to get like a little caregiver boot camp first. Because with dementia, Wayne, you said it, with dementia, it can be so tiring that if you're not prepared to know who to hand off to, you're hurting your own health. And that's no good for anybody in the family. Okay, so training, AARP, the Alzheimer Foundation of America. Check them out. And the Alzheimer Association, you're looking at caregiving types of programs first.
Yeah.
Then after that, you'll have an idea, okay, this is the services we may need. This is what I can do. This is what my brother can do. You put your team together and you allow people on the team to function and do what they can do.
Right.
And what's going to happen is your loved one, your mother or father, is going to thrive with a good team. But when the team isn't good, they tank. And we see it as doctors. We see it. So if take that time and learn about what's the disease like at different stages, how to prepare yourself for that.
And if I could just add to what I also see is 9 times out of 10 within the family, generally it's one person in the family who gets the lion's share. And so it's important for that person to look outside the family and then not to resent other family members who have not stepped up.
Exactly. Dr. Mel,
people have different capacities.
Exactly.
And just because you do doesn't mean that you have to expect other people to be able to have that same capacity. And the other thing I just want to throw in really quickly is in interacting with your parent, whether they have Alzheimer's, if they just have the normal memory loss of aging, patience is so important. That's one of the things that I had to learn as an emergency physician. I like things that happen like that, right? And
Oh my goodness.
my journey was learning patience, and also don't argue with the person who's experiencing memory loss. Just redirect, be patient.
Yes.
Their reality is their reality. You don't have to impose what you think is reality on them. Let them, as long as they're not doing anything harmful to themselves.
Right.
Just don't argue. It's not worth it.
What I would say to families too, if you get into an argument with a person who has Alzheimer's disease, you get what you deserve. You are going to lose. You will always lose. Remember that. You will always lose. You're not going to win nothing. You are going to lose. So don't do it, as Dr. MEL said. And if it's so hard, my people would say, Dr. A, I just can't. I have to say something. That is just wrong. And I say, can you do this? Can you go, mm-hmm? And they go, yeah, we can go, mm-hmm. That's all you do. That's all you do. That's all you do.
Dr. Aggarwal, you said something so important. The training is huge, but a lot of times we don't have time for the training.
Right.
We're figuring out that it's happening, and then we're in it. We're in the caregiver capacity. Right. But I do think that the resources you've indicated, those trainings are crucial. The webinars and all of that. And even what Dr. MEL said, she had to learn patience. There's so much that we're learning on the job. Learning not to argue was something that I had to learn. Be with my aunt where she is.
Yeah.
There's no point in arguing about anything.
No.
Yeah.
Just lean in. No, but listen, it's so true. When you're in it, right? That's the problem. You're in it, and I got to do something. So, here's a challenge to all of our listeners tonight. Just start making it part of your monthly. I'm going to just listen to a webinar and just hear what people are saying. Wow. I'm just going to take bits and pieces. Okay, I'm asking for bits and pieces, not the whole thing, a little bit at a time, so that when it presents itself, as Wayne said, and it will, that you are not so, I had no idea. True, when you're in it, it's a whole different thing. But to be equipped to know, this is what could happen. Okay. You are receptive to different ideas of how to handle things. And that will make it a little easier, but not completely easy. It's tough. Caregiving is really tough.
It's a whole nother episode that we're going to have to get to, because unfortunately we are out of time. Thank you so much, Dr. Aggarwal. This is a tough topic that you have made easy to understand, given us some wonderful pearls. Thank you so much, Lila and Wayne, as always. And of course, to the Be Health Empowered audience, thank you for putting everything you've put in the chat, asking these great questions. We really appreciate you. And remember, until next time, when we see you again, be wise, be well, and be health empowered. Thanks for tuning in.
Bye, everyone.